most important thing is to know that your physician really cares about you and your outcome as an individual patient. They're not interested in signing you up for something. They're really interested in getting the very best possible vision for you as a person, for something not only to work, but to work better, to last longer, to provide better vision, basically to give our patients a better quality of life. In some cases, that can be the standard of care. The existing treatments we have are very good. In some cases, the existing treatments are not good enough, and that's where you can open up the doors to look into clinical trials and clinical research, to offer you treatments that won't become available to the general public for 2 or 3 years. You get access to new treatments that we think are better than our existing ones, and they're not available to anyone else. These are big nationwide trials enrolling hundreds of patients. The trials that we participate in are heavily vetted. They've all had some degree of success before they ever get to this stage. We have independent data safety and monitoring boards. All of our studies have rescue protocols built in. Because we're spending so much extra time monitoring patients, we catch things very early. If we see that a patient is not doing well, we can always pull them. We can always do other treatments. And again, our main concern is not to take care of the research protocol, it's to take care of the patients and their safety and their welfare. They always come first. Sometimes patients can't afford treatment or they can't afford transportation, and clinical trials are a great way to get access to care without having the big financial penalties. It can be hard to qualify for the studies, but if you can qualify, the treatments we have are state-of-the-art. They're the very best thing, and they're what other doctors will be using in 2 or 3 years. I've seen a remarkable turnaround in their health. I've had some diabetic patients that really struggle to control their diabetes, and as soon as they enroll in a clinical trial and they're surrounded by motivated people who are constantly looking at every part of their health, I've seen a lot of them get their diabetes under control. So it really is kind of a way to push reset and to really commit some time and effort to your own health, and I've seen a lot of patients do very well. The biggest thing to think about is the time commitment. We do offer free transportation, but at the same time, the visits are much longer and more detailed. That's really for safety reasons. Because these are clinical trials, we make sure that everything is perfect, even to the smallest details. Everything is checked and double checked, so it can take time. We take great care of our patients. We buy them lunch. We really try and make the time go by quickly, but yeah, it is a time commitment and you need to realize that. A lot of patients find value in contributing their time to clinical research. They're helping themselves, but they're also helping lots of other people. All the wonderful treatments we have now in ophthalmology are because somebody somewhere volunteered their time to be in a clinical trial. And we see continuous progress, and it's because of people like our research patients.